He was mistaken for a cleaner, without knowing who he really was. When the emergency situation began, no one expected him to take matters into his own hands. One step forward, and everything in the hospital changed. This is a story about how dignity speaks louder than words, and true strength requires no introduction. Don't forget to subscribe and like so you don't miss new stories. Willow Creek Memorial Hospital awoke slowly, with the smell of coffee and sterile gel and the soft honking of the hallways. Outside, the morning was overcast, as if the day was in no hurry to begin, and gray clouds hung lazily over the roof, casting shadows on the glass like wrinkles. On the third floor of the surgical building, where they always hurry but never run, Dr. Malcolm Hayes appeared. He came in through the side entrance, casually, without attracting attention. He was wearing dark blue scrubs, plain, no markings, and a warm, turtle-necked jacket over them. His hair was cut short, his face clean-shaven, his movements precise but soft. He was holding a thermos and a small folder of papers. A badge hung on his chest. Dr. Malcolm Hayes, Chief of Cardiac Surgery, but no one read it. A nurse with a gurney was walking towards him in the corridor. "Hey, sir." She nodded quickly. "There was a coffee spill in room 7. Can you help me wipe it up before it sticks?" Malcolm's gaze lingered for a second, then he nodded. "Certainly." He set the mug on the windowsill, grabbed some paper towels from the janitor's cart next to him, and walked into room 7. The floor was indeed sticky. He dropped to one knee and wiped it off. A young intern stood nearby, looking at him with raised eyebrows and amusement. "Are you one of those who is on duty today?" he asked. "The new one?" "Something like that," Malcolm answered calmly. "You're being harsh with the schedule. 5:30 in the morning is insane. My eyes are still wide open. You get used to it." The intern chuckled and left. Malcolm stood up, threw away the paper, and walked toward the elevator. He was in no hurry. He always walked as if he knew that haste was the enemy of precision. The staff lounge was noisy. Several doctors were drinking coffee, discussing the match, and a patient who apparently was faking pain to get attention. In the corner sat Lisa, a veteran nurse who had worked with Malcolm for 6 years. Their eyes met, and she nodded but did not approach. "Hey, man," someone said from across the room. "There's an overturned glass by the trash can. Take a look if you don't mind. The cleaner's late today." Malcolm walked over, picked up his glass, wiped it with a napkin, didn't say a word. "By the way, who are you anyway?" the same doctor asked, chewing a donut. "I haven't seen you. Where's your badge?" Malcolm turned, silently lifting the card on his chest. The man blinked. His eyes slid over the line. His face changed. But he said nothing. He just turned away. And he didn't joke anymore. Malcolm poured himself some water. He returned to Lisa. "You could say hello like you always do," he said calmly. "I said hello," she answered quietly. "They're just looking. Let them look." She fell silent, her eyes full of guilt. "Sorry." "You're welcome. It's not your shame." He went out. There was silence in the hallway, that thick, tense silence when you feel every step on the floor. He returned to the staff room, turned on the desk lamp, and opened his diary. His day was scheduled: morning rounds, meeting with the patient's relatives after surgery, discussing the schedule with the assistants, everything as usual. Only no one except him knew that this was his schedule. He heard someone say loudly in the corridor, "So what? A surgeon is a status symbol. It's a suit, a tie, a beard, after all, and not a silent guy with a bucket in his hand." Malcolm sighed, closed the diary, replaced the pen, stood up. He wasn't one to raise his voice. He was just waiting for the moment when he wouldn't have to say anything, because his job wasn't to argue, it was to save, and that moment was approaching. The day moved slowly, as if it were trying to avoid what was about to happen. Willow Creek Memorial Hospital lived in a familiar rhythm: appointments, tests, calls, short conversations at the coffee machines. But in this rhythm, something trembled, like a thin thread stretched to its breaking point. Malcolm Hayes sat in the staff room. It was drizzling outside. He listened to the raindrops hitting the glass and flipped through the logbook, pages of notes, times, notes, sometimes awkward, but honest. His laptop sat open next to him, a list of patients blinking. One of them was a 32-year-old man who had arrived that morning with severe chest pain. "Dr. Hayes?" Nurse Heather appeared at the door. "They're looking for you from the emergency room. It's an emergency." "What's happened?" "Young man, driver, passed out at the wheel, miraculously didn't crash into a wall, presumably a ruptured thoracic aorta. We call Larkins, but he's stuck in traffic. Says he'll be there in 20 minutes. How long since admission?" 9 minutes ago. Has he been stabilized?" "Not yet. The anesthesia is being prepared. The ECG is on its way. But everyone is waiting for Larkins." Malcolm put the magazine down and stood up, his face calm, but his movements collected. "Which operating room are they taking you to?" "In the 5th. He stepped toward the door. As he passed the elevator, he heard one of the residents say to another, "Well, until someone normal arrives, let them at least maintain the pressure." Look at him, giving orders. A professor without a suit. Maybe he can also treat? Malcolm stopped, but didn't turn around. He just took a deep breath. The operating room was almost ready. The team stood, shifting from one foot to the other. The young patient on the gurney was pale, his chest barely rising. The monitor showed a drop in blood pressure. "Where is Dr. Larkins?" the anesthesiologist asked. "He's not answering. They said on the radio that he's in a traffic jam. He's stuck on the bridge. We need a leader. We can't start without a surgeon." "If we wait, he won't live that long," Heather said. "We're losing him." Malcolm stepped forward. "I'll take over the operation." Everyone turned around. There was a short pause. Even the sounds of the machines seemed quieter. "Excuse me?" the nurse asked at the monitor. "We don't have time. I'm the head of cardiac surgery. I know what to do." "It's a joke? Check my badge if you have any doubts." Heather came closer, looked, her eyes widened. "He really is the manager," she said. "That's right." "But why does no one—" someone began. "Because no one asks. And now, I ask for silence." He put on his gloves. Quickly, without unnecessary movements, he walked up to the table. His voice was even, as if he had already given these commands 100 times. "Is the anesthesia ready?" "Yes." "Pressure?" "It's falling." "Let's begin. Scalpel." No one argued anymore. Malcolm's hands moved clearly, confidently. He did not raise his voice, but every word he spoke cut through the air as only the words of a man who knows what he is doing can. Maintain the rhythm. Monitor oxygenation. Don't get distracted. We don't need time. We need calm. After 10 minutes, it became clear that he was coping. One of the nurses whispered, "I've never seen anyone make a cut like drawing." "Because he doesn't draw. He returns." "What?" "Life," Heather said. The patient's breathing became more regular. The lines on the monitor evened out. The pressure stabilized. Malcolm wasn't looking at faces. He was looking at the stitches, at the point above the heart, at the breathing. When the operation was over, he took off his gloves, wiped his forehead, and walked to the sink. The water was cold but clean. Fox was waiting for him in the corridor. "I saw it. Everything, from beginning to end. He will live. I know. And now they know too." Malcolm looked at her. "They will understand not today, maybe tomorrow, maybe in a year, but it doesn't matter anymore." "Why?" He looked at the window. It was drizzling outside, but now it seemed light. "Because I did what I had to." And they paused. "And what does this mean?" "It means that someone heard silence for the first time, and in silence they don't always shout. Sometimes they watch, and they look differently." The operating room gradually emptied. The machines were still beeping rhythmically. The echoes of the last commands were still in the air, but the tension was slowly fading, like a taut string after a long note. The patient was wheeled out to intensive care, and now only whispers, glances, and the rustle of water running from hands remained. Malcolm stood at the sink. He didn't look in the mirror, just held his palms under the cool stream, as if he wanted to wash away not the blood, but everything that had come before. He knew he hadn't broken, and he knew that others had seen it. Heather was the first to arrive. Dr. Hayes. Her voice was quiet but steady. Thank you. I just did my job. None of us were ready. None, except you. He turned off the water and took a paper towel. This is not the first case. It's just the first one, in front of their eyes. Heather nodded, her gaze direct and respectful. Did you know that you wouldn't be recognized? I knew they didn't want to find out. It's a little different. Footsteps were heard from the corridor. Dr. Larkins looked in the door, wet with a steamed face, a robe thrown over his shoulders, an agitated look. What's wrong with the patient? Alive, Heather replied. Who performed the operation? Malcolm turned around. Larkins froze. You? Yes. Silence. Tense, almost painful. I'm sorry, I didn't know you were here. Because you don't look. You only see what you want. I didn't want. No need. Malcolm interrupted. You're too late, and we saved a life. Everything else comes later. He passed by without saying another word. In the hallway, the janitor approached him, an old man with a gray mustache whom Malcolm saw in the mornings. Rough day? Not the best. I heard. They say you work miracles, and I thought you were one of us. Or maybe that's true. Seriously? We both clean, just from different sides. The old man grinned. You said that well. Malcolm nodded and moved on. The lounge was almost empty. It smelled of cold coffee and wet cloth. Lisa was sitting by the wall. She stood up when he entered. I know you don't want to talk, but I have to. No, it shouldn't. I should, because I was silent. I saw how they looked at you. And I said nothing. You didn't have to protect me, just not hide me. I was afraid. I know. They fell silent. Then the fox added, when you were standing at the table, you weren't a doctor. You were as if all the light in the room was you. And I felt ashamed that I hadn't seen it before. Malcolm looked out the window. The sky was beginning to clear, a streak of blue appearing in the gaps in the clouds, as if someone had quietly erased some of the gray. It's all right, Fox. You see now, that's enough. And you will stay? Where should I go? To leave means to leave those who have not yet understood. She sat back down, bowed her head. Thank you. He walked up to the counter and poured himself some water. This time, he took his time. Fox? Yes? Tomorrow morning when you enter the doctor's office, say, good morning normally, without looking back. She smiled. I promise. He left the room, leaving behind a sense of something irreversible. People were whispering. But there was no mockery or doubt in those whispers. Only respect. He didn't shout, he didn't demand. He just did what he had to do. And that was enough to change the air. The morning came calmly. A thin film of moisture lay on the glass, reflecting the soft light of the first rays. There was an unusual silence in the doctor's office. Not the anxious one, when you expect trouble, but a different one, like after a long rain, when everything around has become a little quiet from relief. Malcolm walked in slowly. He was never in a hurry, especially today. There were two doctors standing by the coffee machine who hadn't even glanced in his direction the day before. When they saw him, they both stopped. One raised his eyebrows, the other looked down. Malcolm walked past as if they weren't there, but their silence remained in the air, heavy, unfamiliar, making you want to straighten your back. He opened the cabinet and took out a folder with the operation schedule. Even columns, even letters. Everything was as usual. Only the atmosphere was different. Footsteps could be heard behind the door. Conversations became more muffled. Words were more careful. Dr. Larkins walked into the room. He was holding a paper cup, and his face was tense, as if he hadn't slept. He stopped at the entrance. "Dr. Hayes?" Malcolm didn't look up right away, only after a second. "I'm listening. I wanted—" He paused, exhaled. "I wanted to thank you for yesterday, for not waiting, for doing this. For saving the patient? Yes. This is my job. Anyway, I should have been there. But you weren't there. And that's your job too, to be." There was a pause. The silence became denser. "I was wrong," Larkins said quietly. "In my assessment, in my tone, in everything. This is not an apology. This is a fact." "Good. Then, take it as you wish. But if necessary, I will be there. I hope you won't be late." Larkins nodded. His shoulders slumped slightly, as if he had lost not the argument but his pride. He walked out without looking back. Heather followed, a new folder in her hands and a calm look in her eyes. Morning reports, and the consultation schedule, and a list of thanks. Thanks? The patients who heard what happened want to express their gratitude. To me? To you. Do they know who I am? Now they know. Malcolm flipped through the list. Names, dates, little words at the side. Thanks for being the first. You did more than just surgery. Now I believe. He put the sheet aside. Did you ever think that all this would start to change? Sometimes, but I was afraid to believe. And now? Now I see that even one voice can change the noise. He walked out into the corridor, slowly past the residents, who stood up when he appeared. Some said, "Good morning," some simply nodded. And it wasn't out of habit. It was out of respect. The Fox was waiting by the elevator. "Are you coming?" "Yes. They say you were offered to conduct a seminar for young surgeons." "They suggested it. Did you agree?" "I'm still thinking." "Why?" He looked at her, his eyes warm but firm. "Because I don't want to talk. I want them to see it for themselves, not in words, but in actions." "Then just be there." The elevator opened. They entered. "You know," said the Fox, "I used to think that strength was loud. But then I realized strength is a step that everyone takes when one has already taken it." Malcolm didn't answer. He just nodded. And when the elevator doors closed, a light trace of his presence remained in the corridor, like a line left by a scalpel. Thin, precise, and indelible. The morning was clear, as if the hospital had been cleansed overnight not just of dust, but of something deeper, an invisible weight that had hung in the air for too long. The glass reflected a clear blue light. The corridors were filled with a soft glow, and the staff moved measuredly but with a new precision, as if something in the rhythm of the building had changed. Malcolm walked into the staff room as always, calmly, without a sound, without expectations. He was wearing the same dark coat, the same badge with the same inscription, the same careful movements, the same restrained gestures. But everything around him was not the same. "Good morning, Dr. Hayes," the young resident greeted him first. Not hastily, not through clenched teeth. Clearly, with respect. "Good," Malcolm nodded, pouring himself some water. "Will you be in cardio today during your rounds?" "Yes, at 9. Can I be with you?" Malcolm looked at him. He stood straight, his eyes not lowered. "Of course. Take a notepad, and listen more than you speak." "Yes, sir." Heather appeared at the door with a tablet. Dr. Hayes, we have a new patient with an unstable rhythm. Room 16. Thank you, I'll visit him after the seminar. Seminar? Yes, in the conference room. I agreed to give an introductory lesson for the junior residents. Heather smiled. The right decision. He nodded, glanced at his watch, and headed toward the elevator. The room was already waiting. Rows of chairs, a table with a projector, but no slides. Malcolm walked in, and everyone fell silent. The front row was filled with young people, with tense backs, notebooks, and a little fear in their eyes. He didn't go to the podium. He just stood in the middle of the room. I won't give a lecture today. You'll have enough slides over the next few months. Today, I want you to remember one thing. Being a surgeon isn't about speed or status or a loud voice. It's about patience, about precision, and about choice. Every time. He paused. There was not a sound in the room. I didn't ask you to respect me, and I don't demand recognition. All I want you to remember is that a man is not measured by the shape of his robe or the loudness of his title. He is measured by what he does when no one is looking, and by how he behaves when everyone is looking. Someone lowered their eyes. Someone squeezed the pen tighter. If you ever have to choose between keeping quiet or standing up, stand up, even if your legs are shaking, especially if they are shaking. He fell silent. Then he nodded briefly and left. Lisa was standing in the corridor. She had a cup of tea in her hands. I heard, that's all. So it was all worth it. They will remember. I didn't want them to forget. I just wanted them to see. You know, you've become somehow softer. No, it's just that now I don't have to be tough to be heard. They walked down the corridor together, slowly. Past the wards, where nurses smiled at the doors, where patients looked after them, and where someone opened a notebook with a new page in the staff room. When Malcolm opened the door to his office, he saw a sheet of paper on the table. A plain one with some text printed on it. The title, Nomination for Surgeon of the Year Award. His name was in the column. The signatures were from colleagues. Some of them he had never seen before. He folded the sheet in half, put it in the drawer, and closed it. The awards weren't important. What was important was that now, when he walked into any room, he was no longer a question. He was the answer, quiet, but final.